The worldwide death toll from the coronavirus continues to grow as it's now deadlier than the SARS outbreak of 2003. Welcome to this special edition of Full Circle. I'm Anderson Cooper. There's still a lot of unknowns about how the coronavirus has spread so fast. We'll talk to Dr. Sanjay Gupta in a moment to answer all your questions about the virus. But first, a little about what we know. Reports of what we now know to be coronavirus were detected in Wuhan, China in December of this past year, and in just a few short months, it spread across China and is starting to spread around the world. Confirmed cases across Asia, Australia, Europe, and in the United States. Fears of a global epidemic are very real, and as the situation grows, we ask for your questions, and we're going to try to answer as many as we can. Joining me right now is CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, thanks for joining us. So a viewer wants to know, how do they test a person to see if they have the virus? How long after the test are the results available?
Yeah, well, this was one of the big breakthroughs with regard to this outbreak. They were able to develop a test. In this case, they can do something as simple as a nasal swab even. They can test blood, whatever it might be. But when they're doing this test, they're basically looking for the presence of the what's called the RNA of the virus, and then analyzing that RNA and seeing if, in fact, it is this coronavirus. It can be done within a few hours, which has really been a big deal as far as these screenings go. You can imagine if someone comes in, the test results take a few days, you don't know if the person has the virus, they could be inadvertently infecting other people. Getting the test done quickly with this very recently developed test has made a big difference.
How long does, another viewer wants to know, how long does the virus stay in your system?
Well, that's a good question, and we don't know the answer. You know, when we call this a novel virus, a new virus, I guess it's sort of obvious that we've not seen this virus before, but it also means that we can predict certain behaviors of this virus, but we're not entirely sure because this is a brand new virus, certainly circulating in the human population. They think it's, up to a couple of weeks that the virus can stay in the system. It's part of this incubation period between the time someone gets infected to the time they develop symptoms, about 2 weeks. So roughly around that time, they think the virus will stay there.
So if you're infected, this is a question I just had based on what you said. If you're infected, how long does it, and you haven't gotten symptoms yet, if you get the test, would you test positive for it? Or does
You can test positive. First of all, the only people that should be getting tested, to be clear, are people that are considered at risk for some reason, have traveled to that part of the world, have come in contact with someone who is known to be infected.
Right. If someone in the United States just now gets a cough, they don't necessarily need to think they have the coronavirus.
No, they don't need to think they have the coronavirus. And what's happening a lot in emergency rooms is that people are showing up concerned, maybe understandably concerned, and wanting to be tested for coronavirus, and they're being told no. And the reason they're being told no is that they're at very low risk for this actually being the case for them. So they don't want to start this sort of random act of screening people for symptoms that are most likely a common cold or the flu, which are certainly much more common in the United States. But when you're looking at this particular test and you think about how long afterward, if the incubation's up to 14 days, it can be longer than that perhaps, but 14 days is what the public health officials think it is now. Everything sort of circulates around that number.
And someone else wants to know, how do people die from the coronavirus? Do they all get pneumonia?
Yeah, no, it's interesting, and not everyone gets pneumonia. There is a certain percentage of people get pneumonia who are more likely to have weaker immune systems, have some sort of what we call compromised immune system. Think of this, the virus gets into the body. The body is the host at that point. The virus needs the host. If it can, without being killed off by the host's defense systems, it'll start to replicate within the body, replicate within the cells of the body. And at some point, it may start to overwhelm the body, affect many different organs. One of the ways that commonly, people do die from this is because of respiratory type things, such as pneumonia, such as something known as ARDS, ARDS, which is acute respiratory distress syndrome. But that's not the only way. So, it's critical to think about the virus potentially affecting the entire body.
We've got another question. If somebody dies from the coronavirus, is the virus still going to maintain in that person, or is the virus going to die with him?
The virus is basically going to die with the person. I mean, there are certain pathogens that can live after the person or the host in this case has died. But with this virus, they really need a host. The reason they're even going into the human body is to find a host. When that host is no longer living, the virus will die shortly thereafter.
It's very easy to see these images and to start to freak out about this. As you said, people in the U.S. are showing up at emergency rooms asking for a test, even though they haven't been to Wuhan in China. There's little likelihood they actually have it. So just how is this spread?
Well, it appears to spread with close human contact. I mean, initially there was concern within those markets in Wuhan, from those animal markets, that it was making this jump from animals to humans, which frankly, and you and I, Anderson, have traveled, you may remember when we were in Africa, that's how a lot of viruses get into the human population most.
Right, they're called zoonotic viruses.
Exactly, and there's this constant chatter that's happening. Viruses swapping back and forth, animals to humans, and also humans to animals, and most of them don't cause any kind of disease, and you wouldn't even really know it. But every now and then, a virus makes a jump, a pathogen makes a jump, and it causes disease. We saw it with other viruses in the same coronavirus family. SARS was one of those examples. MERS, MERS, the Middle East Respiratory Syndrome, another one of those examples. But that's typically how this is happening, the animal to human jump. Now in China, what seems to be the most common mode of transmission is human to human, and typically in close contacts, so 3 to 6 feet away. Different, for example, than something like measles, where if I were in this room and I had measles, even a couple of hours later, if someone came into this room that wasn't vaccinated, they could get measles. Here, it's really close contact, 3 to 6 meters, they say, and the virus might live on surfaces that you can touch for a few hours. After that, the virus dies. If you touch that virus and then touch your nose, your mouth, that's another way that people can get infected.
Another viewer wants to know, what are the differences in symptoms between the coronavirus and this year's flu?
Well, they can be very similar in terms of symptoms. I mean, I've been reading this literature very carefully. When you look at coronavirus, you may be more likely to have shortness of breath early on. You may have fever, slightly delayed. But I can tell you that the differences in symptoms aren't significant enough to be able to tell just by looking at symptoms that one is coronavirus, one is flu. Just statistically, though, Anderson, as you know, if you do develop these symptoms in the United States, it is far more likely to be the common cold or flu, because those are circulating much more robustly than this coronavirus.
And I mean, more people die of the flu. Yesterday we had Will Ripley on, who was for reporting on this, and he was pointing out, I mean, more people die of the flu in the United States every year than certainly so far or likely to get the coronavirus.
It's not even close, right? I mean, if you go back to 2017, I think it was over 60,000 people. 60,000 people died of the flu in the United States alone. About 500,000 people around the world died of flu. So it's far more, in terms of numbers, a far bigger concern. And, you have millions of people who get the flu. Thankfully, the fatality ratio for flu is still low, but millions of people do get the flu. Tens of thousands of people die. Those numbers are going to be much larger, than SARS, for example, was 8,000 people got infected, 800 people died. So it's exponentially higher when you think about the flu.
Yeah, you just mentioned SARS. I mean, the coronavirus, it's killed more people than SARS, but the death rate for SARS is said to be higher than the coronavirus. Can you? That confuses me.
No, well, there's two things that people should pay attention to when looking at these numbers. And there's lots of things, but the two things, if you pay attention to these two things, you're going to get the context of this. One is transmissibility, and one is lethality, how likely it is to kill. And you got to look at these numbers in context. So as you point out, there were close to 800 deaths with SARS, 8,000 people infected. It was right around a 10% fatality ratio. Here you do have more deaths than SARS, so we get closer to 1,000, for example. If you have 40,000 people infected, it's closer to a 2.5% fatality ratio. What you are hearing as well, Anderson, from some of the researchers out there, especially in Hong Kong, they think that the number 40,000 could be wildly undercounting the number of infections as well. And when you hear that, you think, well, that's terrible, and it's obviously not good, but keep in mind, there may be tens of thousands of people, especially in China, who either have no symptoms or just minimal symptoms. So now if you apply that number, the number of deaths, which that number is going to be more known, close to 1,000, over 100,000 or 200,000, obviously the fatality ratio goes way down. So transmissibility, you obviously want it to become more transmissible. Lethality, obviously don't want it to become more lethal, but you got to look at both those numbers in context.
There's another question from a viewer, which I know I was about to ask you if we didn't get a question from a viewer on it. How much does wearing a mask actually reduce the chance of infection?
Well, and again, I understand people want the masks, and in Wuhan, for a period of time, they were saying these masks were recommended for everybody living there. You look at the masks, and you might imagine that the paper masks in particular are not going to be very good at stopping a viral particle from either getting through it or getting around the sides of the mask. I mean, these aren't the kind of masks that stop microorganisms from getting into your system. I think there's two uses, though. I don't want to completely minimize them. One is for somebody who's already sick. It may decrease at least the amount of virus that they are releasing into the air. The other thing is that for people who aren't sick, one of the most common ways that they get sick is, again, by touching surfaces, then touching their nose, touching their mouth. We do that hundreds of times a day subconsciously, and if you are in an infected area and touching these surfaces that have the virus on them, that could be a real risk for you. Wearing a mask oftentimes just serves as a reminder not to do that. Stay away from sick people, not touching your nose and your mouth with an infected surface, and making sure that your own hands are constantly clean.
There's another good question we got, which is coronavirus has been called an outbreak, not an epidemic or a pandemic. What is the difference?
Well, it's a little bit of semantics. Outbreak and epidemic are very similar terms. Outbreak can sometimes refer to a smaller geographical area, epidemic a larger geographical area, and pan, which means world, really means that the virus is circulating around the world. There's specific criteria, so it has to be circulating in at least 2 continents, evidence of sustained human-to-human transmission, but epidemic and outbreak are often used interchangeably.
One final question here: if people for the virus who are asymptomatic, how effective are travel bans? Because even if you don't have a fever, you could be carrying the virus.
Yeah, no, that is a really good point. And I mean, the person is basically saying, look, you could have an infected person would completely pass all screenings because they're asymptomatic. They could travel around the world several times in a few days and then develop symptoms. Absolutely true. And that's no matter what, the number of outbreaks that I've covered, that always comes up, is this incubation period. What I would say is that for that reason, it's very hard to imagine that travel bans coming out of China would necessarily be that effective because of that incubation period. I think it makes sense to limit your travel to a known infected area, such as the Hubei province in Wuhan in China. But other than that, to sort of say these larger, more all-encompassing travel bans, just from a physiologic and looking at the epidemic of the disease, it doesn't make a lot of sense.
So just big picture, we should be aware of this, we should know about it, we should not be freaked out about it completely.
Yeah, I think in the United States, it's low risk. That's what everyone's been saying. It is a new virus, so people always are worried about new viruses. In 1919, there was a worldwide, a pandemic. 50 years later, there was another pandemic, and everyone thought that 2019, which was 50 years after that, there was going to be another pandemic. Not that these things fall in 50-year cycles necessarily, but I think when this started to circulate at the end of 2019, there was this feeling in the public health community, is this it? Is this that pandemic that's, come 50 years later? Right now, we still don't know. There's still a lot of unknowns. But I think the question a lot of people are asking themselves, is this going to spread around the world? And is it going to be sort of a really bad cold/flu or something worse? Right now, it's teetering towards being a bad cold or flu as opposed to something worse.
All right. Dr. Sanjay Gupta, thanks very much. Appreciate it.
You got it. Thank you.
That does it for the special edition of Full Circle. We'll be back 5 p.m. Eastern Time tomorrow. Remember, you can stream the show anytime by going to cnn.com/Full Circle. Until then, tune into CNN's special coverage of the New Hampshire primary tonight. Thanks.